At Benson, engineers put a Puma Mark II through its paces. This Oxfordshire station is the hub for one of the military's key contributions to the battle against COVID-19. A helicopter force dispersed around the country to provide the NHS with 24-hour aviation support, transporting staff and life-saving equipment and flying seriously ill patients to intensive care.
You're right. Most of my crews, the crews across the force, in fact, are experienced Afghanistan, Iraq, operational pilots from across the piece, and this is very different for them. Taking essentially a military equipment designed for the battlefield and personnel that are used to being on the battlefield into a civilian operation like this, where we're dealing with civilian passengers and critically ill civilian patients, NHS clinicians, is a very different task. Of course, it's made even more challenging by the fact we're having to operate in some areas high risk with PPE, decontamination, social distancing measures. These are all completely new ways of working for us, but we're finding a way through that.
The force includes Army, Navy and RAF helicopters from Joint Helicopter Command, with aircraft deployed to bases up and down the country. Covering Scotland and Northern England down to Newcastle are 3 RAF Pumas based at Kinloss Barracks. 300 miles south, 2 Wildcat helicopters flown by the Army Air Corps were forward deployed to RAF Leaming in Yorkshire to cover the north of England. Supporting the NHS across central England and Wales are 2 Chinooks from RAF Odium in Hampshire and a further 2 Army Wildcats based at Royal Naval Air Station Yeovilton in Somerset. Finally, also covering the south, as well as the Channel Islands and the Isles of Scilly, are 3 Royal Navy Merlins based at RNAS Culdrose. So far, the Aviation Task Force based here at Benson has flown 2 emergency missions related to coronavirus, one to the Isle of Jersey and a second at the end of last month to the Isle of Arran off the north coast of Scotland. A Puma helicopter like this, based at Kinloss, made the trip to the island to collect a patient showing critical symptoms of COVID-19 and then evacuated that patient and his NHS emergency team back to hospital in Kilmarnock. Captaining the Puma on that potentially life-saving mission was Squadron Leader Johnny Longland.
So in this situation, the patient was critically ill, but we didn't know whether he had coronavirus or not, so we erred on the side of caution. So all of the crew then wear PPE such as face masks and gloves in order to protect ourselves from any potential contamination. So it's not the first time we've done med-evac, but primarily for us it's military CASEVAC, med-evac. So my crew and I, we've done lots before between us in Afghanistan and in Africa on military CASEVAC, but it's the first time any of us have had the chance to support the NHS or to support the civilian agencies in the UK.
Coincidentally, a few days before the Isle of Arran mission, Johnny and his crew flew to the Western Isles to train with NHS medical staff. On the ground, local paramedics were able to familiarise themselves with the Puma and learn how to load a stretcher onto a helicopter. Instructing them was the rear crewman, Flight Sergeant Stephen Cassidy. A few days after that visit, they did it for real.
The guys that were at the Isle of Arran who were dealing with this casualty were also the guys that we'd spoken to previously about how they could use us and what we could do for them. So they recognised me, I recognised them, and we were able to get straight into how we could offload them. They told us what the casualty needed. He was a critical patient who just needed to be moved to Kilmarnock Hospital. So we had a conversation about how to load him, what they require in flight, what the priorities were, whether that was time or stability. Loaded the passenger and off we went. It was a fairly uneventful transit, thankfully. They were working on the patient's stability throughout, but he got there safely. We shut down at the hospital site and we waited for them to deliver the patient to the hospital.
For Benson and 33 Squadron in particular, this new role runs alongside other important operational commitments. A detachment of Pumas from here are based in Kabul, supporting Operation Toril, while Benson is also a training base for new Chinook pilots. For the Squadron engineers, it also means juggling a busy maintenance schedule while still trying to socially distance and, like all of us, protect themselves from infection.
They've adapted really well. I mean, as the commander of the force, I'm incredibly honoured and privileged, to be leading the aviation effort as part of the COVID support force. But the people are, they're really enjoying it because they've got a purpose. Not only have they got a purpose, they're very much doing their bit for the country. And whilst they're used to operating in places like Afghanistan and Iraq, what they're seeing here is a real benefit to their families, their friends. And so, from a commander's point of view, it's easy because they will do anything they can to help out. And I have to turn people away because I get people coming to me wanting to join the force, wanting to take part, wanting to do more. So it's been great.
To date, thankfully, the task force has only been scrambled a few times. And while the politicians wrestle with the UK's exit from lockdown, this military med-evac service will remain on standby, ready to respond and fly to the aid of others anywhere they're needed. If you enjoyed this video, don't forget to like and subscribe to our channel.